Hello, and thank you for being with us today. My name is Karima, and I'm joined today by my co founder, Katie. And this is SEWA Health. Before I dive into our value proposition, I would like to start by defining the word SEWA. SEWA is a Punjabi word meaning an act of selfless service. We use it to define our venture because we believe a bond between a parent and child is a bond of selfless love and care for one another. SEWA Health started from my own personal experience. It was in 1995 when my father was offered a job with WHO, but he had to refuse the opportunity to take care of my grandparents back in Punjab. Now, after 25 years, I am at the same crossroads where I had to leave my parents back in Punjab so that I could pursue my goals in Boston. But it turns out I'm not the only one. Younger generation are leaving India for better job and educational opportunities. However, this challenges a social norm in India that children are supposed to take care of their aging parents. So, to solve this issue, we created SEWA Health, a personalized virtual health assistant for your parents for only $20 a month. SEWA Health offers virtual case managers who schedule client doctor's appointment, track feedback and follow up, and perform weekly well-being check-ins while keeping your overseas relatives informed. Now is the perfect time for SEWA to enter the home health market. In past 3 years, it has made a jump of 87%. This market is estimated to grow over $800 million by 2025, and our services are targeting 87 million elderly people living in India. This market is large and competitive, but we are sitting in a unique position by serving only tier 3 cities and rural communities. We are confident in SEWA Health's ability to gain traction in this market. We surveyed over 100 non-residential Indians across the world, and 88% of our respondents are willing to enroll their parents with our services. It is clear that gaps still exist in home healthcare space. Based on the pilot testing, SEWA Health has a variety of growth options. If our clients require more hands-on medical attention, we will partner with local institutions and directly hire medical staff. Or we could scale the virtual model to other areas as well. That being said, our next steps are to go to India and do an on-ground market research and build strategic partnerships, identify patients and enroll our first clients, and also develop our digital platform and build brand awareness. So, with Katie's expertise in health strategy and my first-hand knowledge of this problem, we are the perfect team to develop this localized solution. Together, we are confident in our abilities to launch SEWA Health and guide it successfully into the future. Thank you so much.
Thank you, Garima. Judges, over you two for questions.
Maybe jump in with a quick one. So really great job with the presentation. One question that I have is around health emergencies with sort of elderly family members. The check-ins are great, but have you thought a little bit about what to do in sort of points in time where emergencies or express questions happen that need to be passed up to an assistant or a health check sort of on a more urgent basis?
Yeah, I can get that one. So actually, that was one of the big assumptions that we were testing in that survey that we gave to over 100 non-residential Indians back when we were still kind of developing our idea. We had assumed that transportation to hospitals and attention during emergencies were really big needs for this community. However, our survey told us differently, that actually in an emergency, they would either call a car or they would have their own car, and that they would be able to take themselves, or they knew someone who they'd be able to rely on in those instances. So in that case, we decided not to focus on that specific area.
Perfect.
What's your plan to kind of market yourselves and distinguish yourselves in the community that you're targeting?
So that's kind of where we've discussed this a lot, because in the specific community that we're targeting with this pilot, it's actually the community that Garima has grown up in, and the doctors we're working with are work at the hospital that her father works at and her mother work at. And so that's initially where our community is going to start. Do you want to take it from here?
Yeah, so our survey also told us that one of the biggest factors is trust. And the reason, if I'm sitting here and I have someone to take care back home, we have to build the trust, and the trust we can build only with very valid partnerships and by, the one who has the reputation and the trust factor. So that's why we want to start with my own hometown, where we can already establish this, and then we can take it further.
Time for one more question.
In terms of engagement for the quadrant that you're looking to work in, the relatively cheap and in rural communities, in terms of the availability of technology and connectiveness, was that a component of the survey, and how easy versus difficult do you think it is to reach that segment of the market?
So we understand that it's going to be a little bit difficult to reach that area. However, that's why we're going to prioritize hiring individuals in the communities to actually work as our community caseworkers. That provides several advantages. First, that they'll actually understand the local language. They will physically know where these people live and are located, even if they don't live in the same area themselves. And they can help build that trust that Garima mentioned earlier.
Perfect.
Okay. Any other quick questions?
Something?
Yes. Go ahead.
One thing I just wanted to add was that one thing we also tested in our survey was the prevalence of smartphones. And it turns out a lot of elderly relatives who do live in these rural communities have access to a smartphone if they have a relative abroad who would be kind of the connection to us there. So furthermore, gaining trust, having those phone conversations, that's something we've thought of as well.
Awesome. With that, time's up. Thank you very much.